But I would be remiss if I didn't mention that across the United States, right? Because I'm not here to pick on Berrien County. Absolutely not. Across the United States, healthcare systems are broken, right? We have our own CDC, Centers for Disease Control and Prevention, coming out with a statement stating that 80% of pregnancy-related deaths are preventable, right? And maybe as a nation, we're not outraged enough by those numbers, because if 80% of planes dropped out the sky and 80% of cars blew up on the middle of the road, we would be upset, right? We would be concerned and we would demand reform and overhaul, right? And it's not to say that we aren't now, but it's just to say that Berrien County and their terrible data, they're not alone. This is a national problem. Birth has gotten less safe for all mothers and birthing people, not just Black mothers and birthing people. However, when we look at the data racially, right, it is especially dangerous and even deadly for Black mothers and birthing people and Native American mothers and birthing people. So the CDC will cite things like not catching warning signs early enough, right? And inadequate care coordination between prenatal care and postpartum care. And all of those things can be true, but the CDC does call out addressing disparities. And that's really where we're gonna see a lot of life-saving action if we can get on board with that plan, right, to address disparities. You can improve care coordination, right? Those are process changes. If you have better care coordination, then it seems reasonable that you would have better management of symptoms or known comorbidities upstream. Those two things really go together. But I think the underpinning that we sometimes miss out on is addressing disparities, because people are losing their lives by being ignored to death. And that's not a care coordination issue. And that's not a late clinical warning sign issue, right? That is a social determinant of health issue. And that is what we see when we see racism in healthcare.